Now we are going to see pregnancy dating. So pregnancy dating has three components. This is, we need to know when does the pregnancy started, and this is to estimate when does the baby is going to be born, or when does the pregnancy is going to finish, and to have an estimation of how many weeks the pregnant is at each prenatal visit, to correlate the gestational weeks, with the ultrasound, and depending on this variation, the variation between gestational weeks and ultrasound, we will determine if we have growth restriction, among other things. So basically, when we talk about pregnancy dating, the most important is to know when does the pregnancy started, to estimate when does the pregnancy is going to be over, and to know exactly, or trying to know exactly, how many weeks is the woman pregnant at each prenatal visit, to correlate with ultrasound to know if we have growth restriction. So how are we going to estimate when does the pregnancy started? Physiologically, when does the pregnancy started is when conception started, which is after ovulation. So after ovulation, then we have conception. Exactly 38 weeks after the conception date is going to be when does the baby is going to born. But most of the time we don't know exactly when was the conception date. Saying in other words, we don't know when was the ovulation date. So we try to estimate this with two things: with the last menstrual period and with an ultrasound. Sometimes we can use a basal core temperature, but most of the time we just use the last menstrual period and the ultrasound. So we have a woman. She doesn't know when was the conception date, but she knows the date of the last menstrual period. So we take the first day of the last menstrual period until the date the pregnant woman is presented at the prenatal visit, and we are going to say that is how many gestational weeks the woman is based on the last menstrual period. This is like plus minus 1 week accurate. The other method we can use to estimate how many weeks the woman is pregnant is with an ultrasound. So we have the pregnant woman is presented at the prenatal clinic, and we do an ultrasound, and based on the ultrasound, let's say the ultrasound measure is the woman is 6 week gestation, for example. So we don't know when was the conception date, but based on this early ultrasound, at this point the woman is 6 week gestation. So we will take this date to estimate the sequence or the other gestational weeks after this. So if the fetus based on the ultrasound is 6, or if the woman is 6 weeks pregnant, we are not estimating exactly when was the ovulation, but we are saying the woman is 6 weeks pregnant. So we will take this as a surrogate of in the how many weeks the woman is pregnant, and depending on the difference between the ultrasound estimation of the gestational weeks and the last menstrual period estimation of gestational weeks, we are going to determine which is the gestational age we are going to be using to correlate that gestational week with the subsequent ultrasound. I mean, if we estimate the gestational weeks based on the last menstrual period and we compare it with the gestational weeks based on an early ultrasound, and if this difference is within the normal range, so most of the times we use the gestational age measured with the last menstrual period. But if the gestational age or the gestational weeks measured with the last menstrual period versus measured with an ultrasound, if this variation is more than the normal range, then we will use the gestational weeks measured with the ultrasound. In this scenario, the ultrasound is the one that most correlates with the accurate date of really how many weeks the patient is pregnant. So now that we know how to estimate how many gestational weeks the patient is, now we are going to use Naegeli rule to estimate when does the pregnancy is going to get over, or when does the baby is going to be born. So this is 40 weeks after the last menstrual period if the patient has a menstrual cycle of 28 days. More specifically, the rule is the due date is going to be 38 weeks after the conception date, but as we already see, most of the time we don't know when was the conception date. So instead of adding 38 weeks to the conception date, because we don't know when was the conception date, what we do is we add 40 weeks to the last menstrual period date. And